All right, you ready to learn some anatomy? Today's topic is body cavities and abdominopelvic quadrants. Okay, so here's a diagram showing all the cavities that we're going to be talking about. You see the cranial cavity and attached to the vertebral or spinal cavity, the cranial cavity housing the brain, the vertebral or spinal cavity housing the spinal cord. In the anterior cavity, the ventral cavity, we have the thoracic, abdominopelvic, dividing into the abdominal and the pelvic categories. But we're going to get in more detail to those now. The dorsal cavity. Remember, dorsal is back, another term for posterior. The dorsal contains two cavities, the cranial cavity and the spinal cavity. So remember, another word for dorsal is posterior. In the cranial cavity, the brain. In the vertebral or spinal cavity, it's the spinal cord. Then we have the ventral cavity. Remember, another term for ventral is anterior, so closer to the front of the body. And in case you didn't know, a cavity is a space, an opening, and it's to house internal organs. And in the ventral cavities is where most of our internal organs are housed. We have the thoracic cavity, and the abdominopelvic category is the broad categories. And the divider between them is a muscle called the diaphragm, which runs right underneath your lungs. Okay. In the thoracic cavity, you are going to find your heart and your lungs. Okay, two lungs, right and left, heart in the center, relatively in the center, roughly right behind the sternum. Think of the sternum as your heart protector. Okay, and it is tilted slightly to the left, so that makes your left lung a little bit smaller, but in general, your heart is in the center of your chest, the thoracic cavity. Okay, again, another way to look at the cavities, you can see the ventral, again, much more contained in the ventral cavities than in the dorsal cavities. Here we focus on the thoracic cavity, which is the space for your heart and your lungs. Notice in this image, you do not see the heart, but it would be located in the center of the chest between the two lungs. So here, you can see that the heart is in fact tilted slightly to the left, as there is a little bit of an indent in the left lung, making it slightly smaller. Now the abdominopelvic cavity, much larger. Okay, it is actually composed of two cavities, which, not surprising, are the abdominal and the pelvic, hence the name abdominopelvic. Okay. The abdominal cavity is right below the thoracic cavity, and then the pelvic cavity is underneath. Okay. The abdominal cavity contains most of your digestive organs, and the pelvic cavity contains most of the reproductive organs as well as urinary organs like the bladder. Okay, so again, dorsal, cranial, spinal, ventral, everything else. Heart and lungs in thoracic, most of your digestive organs in your abdominal cavity, and in the pelvic cavity, your bladder, your reproductive organs, and also your rectum, which is part of your digestive system. And together, the abdominal and pelvic are called the abdominopelvic. The divider between the thoracic and the abdominopelvic is the diaphragm. So A would be cranial, B would be spinal or vertebral, C would be thoracic, D would be that diaphragm, that muscle, E would be abdominal, and F would be pelvic. Together, E and F would be abdominopelvic. Okay, now doctors divide the abdominopelvic cavity into 9 regions. Right hypochondriac, hypo meaning under, chond having to do with ribs, so under the ribs. Left hypochondriac, okay. Hypogastric, under the stomach. Inguinal, the groin. Lumbar, in the lower back area. Umbilical, around the umbilicus or navel. Okay, the terms make sense, but we're going to use a much simpler version. So we're going to use 4 abdominopelvic quadrants. And where the quadrants are divided, the umbilicus, the navel, the belly button, but we're going to call it the umbilicus from now on. The umbilicus is at the center, so that's the dividing line. So I'm going to go down the midline through the umbilicus and then transversely also through the umbilicus to get the abdominopelvic quadrant. Their names are not hard. Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. All you have to do is really remember that we're looking at a body and considering a body in anatomical position. Okay, it's not your right, it's the right of the body you're looking at. Okay, so here is a whole list of organs found in the abdominopelvic quadrants. I'm not going to make you remember all of these in particular. I'm going to narrow that list down and streamline it so you have less to remember. So here, A represents the right upper quadrant, and I want you to remember it contains 3 main things: the right kidney, the gallbladder, and most of the liver. So here, A, do you see this is the liver? See how it does go over into B, but we're going to cover most of the liver in A. B, the left upper quadrant. Okay, the ones I want you to remember in left upper quadrant are the left kidney. Hard to see in this picture because they're closer to the posterior of your body. They're closer to the back. The spleen, okay, kind of hidden behind the stomach over here, and most of the stomach and pancreas. Okay, so remember that for left upper. Right lower is going to be the right half of the bladder down here. The appendix, kind of hanging off the large intestine over there, part of the intestines, and the right ureter coming from the kidney and the right ovary as well. And the left lower quadrant is going to have the opposite of the right lower quadrant. The left half of the bladder, also part of the intestines, the right ureter coming from the kidney, and the ovary. It is not, however, going to contain the appendix. So that is key to the right lower quadrant, which is a key if you're having appendicitis pain. It should be in your right lower quadrant. If you are having it in your left upper quadrant, it would not be indicative of appendicitis. So 1, remember, we're imagining the body. We're referring to the body we're looking at in anatomical position. So 1 is right upper, 4 is left upper, 3 right lower, and 2 left lower in terms of quadrants. Okay, and we can abbreviate them like that without writing out the words exactly. We can abbreviate RUQ for right upper quadrant.